they're sticking to each other, because sperm can stick to each other. They can stick head to head, head to tail, or even tail to tail, or you may have a mixture of these actually on the slide, which you can see. That is already a problem. It's not supposed to be there. We look at the number of sperm in 1 milliliter, what we call the concentration. We looked at the volume. We want the volume to be at least 1.5 milliliters or more.
Okay.
Then we look at the concentration. How many sperms are in 1 milliliter? We want them to be at least 15 million or more.
Oh, wow. In life, should someone start worrying about their reproductive health? And are there any tangible symptoms, especially for men, that indicate something may be amiss, Dr.
I think I'll start talking with the mothers first of all.
Okay.
So when we have this little boy who has been born, and we are all very happy and proud that now I'm a man, because unfortunately that is what happens. Usually what happens is that when this little boy is in the mother's womb, just before it is born, the testicles actually drop into the scrotum.
Okay.
Now, when he is born, they are supposed to be in the scrotum already.
Okay.
So here is talking to the ladies when they are washing their little young men to actually check in the scrotum, just to feel that a tiny thing, there's something there which feels like a bean.
Yes.
It must be there.
Yeah.
Now, that is where we should start checking.
Okay.
Because what happens is that sometimes you find we are not aware that actually the testicles, maybe one side or even both sides, they did not descend into the scrotum. The gentleman will grow up, will have all the secondary characteristics. You have your beard, your muscle, the testosterone is pumping through the system, but the production of sperm will not be there. So you find he gets married and everything is fine. They start trying 2 years, 3 years, sometimes even longer. And obviously everything is okay from the lady's side. The man, he has never been tested. We have an aversion to go and have ourselves tested. So when he comes, you find there is no sperm, azoospermia. So when you talk about azoospermia, there are several reasons why there may not be sperm.
Now, before we go further, when you talk about no sperm, let's be specific here, because for the non-science mind,
yes,
when they're thinking sperm, they're thinking that fluid that comes out during ejaculation.
Okay.
So is that what sperm is? So that means if that fluid is not there, you have no sperm?
No.
Or what exactly does no sperm mean?
Now, blind spot. Ding, ding, ding. That's a blind spot.
Exactly.
It's a blind spot.
Yeah.
Now, normally what happens is sperm is produced elsewhere. It is stored elsewhere. During intercourse, when a man is having an orgasm, sperm pushes, David says we are wonderfully and beautifully made, and that is one of the things. It takes microseconds for that sperm from where it is ejaculated to pass through the tubes, pass through the prostate gland, where it is mixed with seminal fluid. That is the fluid you're talking about.
Okay.
And then it comes out through the urethra, where the urine comes out through as an ejaculate with sperm.
Okay.
Now, when you're talking about azoospermia, meaning no sperm, it basically means that what comes out as an ejaculate is only the seminal fluid, but there is no sperm.
Now, is there a way of knowing that just by looking at it, or is that something that has to be tested?
Very good. Now, we have to test it.
Okay.
That is why now when a couple comes and says, look, we've been trying and this, we've taken down the history. For the gentleman, we tell them it's a very simple procedure. You go to a lab. First of all, you abstain from intercourse 3 to 5 days. You go to a lab, and they'll give you a container, and you give a sample.
You mean they give you a porno and you watch and then you unatoa?
In some places they have, some places they don't. But end result is that we want that sample.
Yeah.
Okay.
Now,
whichever way it
is, there are two
yeah.
ways. Basically, is masturbation most of the time. And there are special condoms, which I don't know whether they're available here in the US, but in the UK they were available. Not the normal condoms, because the normal condoms actually have a spermicide. So once they have given us that sample, it is left to stand for about 15 minutes, what we call liquefaction time. It needs to become watery because there are so many parameters that we are going to check in that sample. First of all, we are going to take it in a pipette and pull it and see whether, it is longish.
Okay.
We are going to look at the color. What color is it? Because that color will give us insight about what is happening. We are going to check the pH of that sample. We are going to look at how long it becomes liquid, becomes watery. Then we start looking at now the sample itself under a microscope, because with the naked eye you cannot see anything, you just see fluid. And again, this is another amazing thing, that out of sperm which are invisible to the eye, it has all the genetic coding that is going to decide Ruth's son or Ruth's daughter is going to have, this height, once they have, mixed with the egg. These are the characteristics of that baby. It's mind-blowing, out of this world. So we look at...
You can get that from the sperm test.
Well, no, we look at the numbers.
Oh,
we look at the character. But now these are things which are in that small head.
Oh, okay.
Everything is there.
Okay.
So we look at first of all, we want to see whether they're sticking to each other, because sperm can stick to each other. They can stick head to head, head to tail, or even tail to tail, or you may have a mixture of these actually on the slide, which you can see. That is already a problem. It's not supposed to be there. We look at the number of sperm in 1 milliliter, what we call the concentration. We looked at the volume. We want the volume to be at least 1.5 milliliters or more.
Okay.
Then we look at the concentration. How many sperms are in 1 milliliter? We want them to be at least 15 million or more.
Oh, wow.
Then we want to look at what is the count. So if you have a volume of, let's say, 3 milliliters, and we have a concentration of, let's say, 20 million per milliliter, so we multiply 3 by 20, we get the count, which is 60 million. And we want it to be at least 40 million or more. Then we look at how this sperm is actually swimming, because in order for it to be able to move from the cervix where it is placed during ejaculation and travel all the way through the uterus and through the tube until it meets with the egg at a particular point in the tube. It just doesn't happen just like that. It is a particular point in the tube. It has to have good swimming ability. So there are 3 or 4 different types of motion or motility. There is what we call type A, which swims very fast. If you can...
Come on, Usain Bolt.
Usain Bolt. The sprinters.
Omanyala.
Why are you going out there?
Stay home. Let's keep it home.
So kuna Omanyala.
Kuna Omanyala.
Yeah.
And then now there's type B, which swim not as fast as the sprinters, but also they have a direction. So let's call that Kipchoge.
Nice. Okay. So it's a marathon runner.
It's a marathon runner.
No,
Okay.
kuna 3,000 meters.
Kuna 3,000.
Tufanye 3,000.
3,000 meters, steeplechase.
Hapa steeplechase. Haya,
Okay.
daktari endelea.
Sawa, sawa.
Ezekiel Kemboi.
Huyo. Alafu
And then there
I
are
know
others which actually just swim in one place and they don't go anywhere.
Okay.
So it's in one place swimming, ni kama zimelewa.
Okay. Yeah.
hold on.
And then there's
I
the
feel
last
attacked.
one, which are immotile. They don't move anywhere. So what we do, we actually take the first one, there's the sprinters, the Omanyalas, and the Kembois.
Yeah.
Hizo ndio tunaziweka pamoja.
Okay.
A plus B. And we want that to be at least 40%.
Okay. Okay.
Sawa.
Okay.
Now, then after that, we go to look at now what we call the morphology or the normal structure of that sperm. It must have a head, which is usually ovoid in shape. It has a neck piece, and then it has a tail.
A tail.
Now, we want that to be only 4% or more. So imagine out of that 60 million, the count,
Yeah.
4%, 10% will be 6 million. So
Yeah.
1% will be 600,000. So 4% will be 2.4 million. So you just want 2.4 million or more.
Okay.
Now, apart from that, we want to see whether there are any white blood cells. White blood cells would actually signify kwamba there is some sort of infection. We want to see whether there is fructose, which is also good for the sperm to swim.
Okay.
We want to see whether there are any red blood cells. That is not a good sign. We
Okay.
want to see whether there are any bacteria or any yeast around there, because that will also mean that there's an infection. Either there's an infection, or the way this ejaculate was collected collected due to normal intercourse. Because during intercourse in the vagina is very, very rich in all manner of bacteria and whatever, which is also important for that ecosystem in the vagina to survive.
Hold on.
Yes.
Repeat again. It's very
Ding,
rich.
ding, ding, blind spot.
It's very rich.
There are good bacteria,
Blind
bad
spot
bacteria.
alert.
We're talking
Bacteria.
about good bacteria.
Yeah.
And we want a balance.